On-the-scene video coverage of ESC 2012 is supported by Pradaxa.
Hello, I'm Tony DeMaria here in Munich at the European Society of Cardiology meeting, and I'm talking with Dr. Deepak Bhatt, who's well known to everyone about some of the highlights of the clinical trials to be presented today. And Deepak, one of the very interesting bits of data relate to the PURE study.
Yes, I thought that was very interesting. Over 150,000 patients from 17 countries enrolled, not the U.S., but Canada and 16 other countries. And what that very nice study showed was a number of things. It looked at risk factors for cardiovascular disease, namely diet and exercise, and found a number of associations with the degree of wealth. Namely that the wealthier people got and countries got, the less likely they were to have physical activity. The more likely they were to take in fruits and vegetables, which would be a good thing, but more likely to also consume fat and saturated fat, less likely to take in carbs. So a bit of a mixed message in terms of the impact of wealth or lack of wealth.
Yeah, it was interesting to me that the poor countries had a great deal more physical exertion, and this stands to reason. They've got to walk, they've got to take bicycles. But what blew me away was that in the wealthier countries, an hour, half hour of exercise every morning didn't quite add up to the same thing. So I may have to increase my own regimen.
Well, I think there's a lot of public health impact from this study. I'm not sure how much as individual physicians we can do, but from a public health perspective, there are already efforts underway in the U.S., for example, to make sure that in more indigent communities that they've got access to fruits and vegetables, fresh produce. So I think measures like that on a public health level can have a large impact.
Very important. And interestingly enough, there seems to be a difference overseas, at least, between rural and urban areas where these disparities are even more marked in the rural areas.
Absolutely. One other thing that was examined was smoking, which as a country gets wealthier, there's less smoking among men. Interestingly, among women, the impact of wealth wasn't as pronounced. That is, they were smoking whether they were wealthy or poor.
Yeah, and that may account for the fact that although atherosclerotic deaths and mortality are dropping in men, in women it's kind of evened out, and smoking may be an important reason for that. Now, one of the bugaboos we all face is so-called diastolic heart failure, HFpEF heart failure with preserved ejection fraction, and the endless, it seems, search for an effective therapeutic agent. Aldo-DHF dealt with that today.
Right, and I think they did a good job. They took 400 patients with so-called diastolic heart failure, I still like to call it that, but 400 patients, randomized them to a year of either aldosterone or placebo, and examined a number of different parameters. So there was no effect on symptoms, unfortunately, no effect on exercise capacity, but there were other parameters that were examined. LVH, for example, was significantly reduced. Blood pressure, obviously, was reduced, so some good things there. You might comment on the echocardiographic parameters.
Yeah, as a trialist, you'll appreciate how difficult it is. When this study was being designed, they selected a primary endpoint as the ratio between transmitral filling velocities and tissue velocities in early diastole. And over time, it's turned out that perhaps that metric is not as valuable as we thought or as accurate in assessing diastolic pressure. So unfortunately, when the results were in, the primary endpoint is not quite as gold an endpoint as they had hoped.
Sure. So some positive signals in that study, but more work needed, both with respect to the specific role of aldosterone in diastolic heart failure and just for diastolic heart failure in general.
Sure. Important to point out these patients did have hypertension, and so maybe this is a reason in the hypertensives to use Aldo, an inexpensive drug that may produce some benefits in heart failure. And the altitude study was another interesting study presented today.
Sure. So, a press release had already been issued about this some time ago, but basically this was a mega trial looking at aliskiren and its potential role. It's, of course, a direct renin inhibitor. And it was disappointing results. It didn't really show any benefit, and in fact, there were some signals even of harm, trends towards more stroke and trends towards more resuscitated cardiac death. Again, trends not significant, but still people were hoping, I think, for real blockbuster, but in fact that didn't appear to be the case. So at least as add-on therapy, doesn't seem to have much of a role, more side effects, more hyperkalemia.
Yeah, the hyperkalemia especially, kind of scary. It's unfortunate. The hopes with the direct renin inhibitor have been very great, and I think we're still searching for that blockbuster indication.
Yeah, I think there's just only so much that we can flog the renin-angiotensin system before, it just cries uncle.
Absolutely. Well, we've got lots more studies to talk about, and we'll be back in a minute.